But GOP leaders are demanding Democrats hit the reset button and start over. And Republican Tom Price of Georgia says if health talks don't start from scratch, he is one congressman who may walk away from the talks altogether. Congressman Price, thank you very much for joining us. Is there anything that you can build from, or do you have to start from scratch?
Well, we can build from the concern and the fear and the anger of the American people, and that is that they don't want the government taking over their health care, and they don't want any mandates or dictates from the federal government as it relates to health care. Now, if we do that, that's a blank sheet of paper, because that's exactly what the Senate bill was. If we start with that blank sheet and then talk about the principles of health care, getting more affordable health care for people, getting more a higher quality for folks, greater accessibility, more choices for individuals. If we think about those principles, yes, then we've got a lot of commonality with the American people, which is where we should be.
But does it damage the Republicans if they do not agree to go into this meeting? The president is saying, let's have a meeting. Let's have a bipartisan meeting. Let's even invite the cameras in. And if the Republicans walk away, won't that put the ball back in their court?
We'll be walking toward the American people. Look, the American people have said that's not the bill that we want. If anything else has been said over the past 3 elections, statewide elections in Massachusetts and Virginia and New Jersey, and if anything else has been said over the last 3 months of the American people saying, stop the madness in Washington, this is it. And that is, get back to square one. Start from scratch on the health care issue, and then we can move forward in a positive way that recognizes that patients ought to be in charge, not the government.
But there are some building blocks, are there? Aren't there some things that everybody can agree on, such as the exemption for corporate payrolls regarding health care payments, et cetera? Aren't there a couple of building blocks to start from? And if so, what are they, Congressman? What are they?
That's one. Greater competition, the ability to purchase insurance across state lines. Trying to solve the portability issue. You ought not lose your insurance. If you change your job or you lose your job, you ought to be able to take it with you. In the area of pre-existing illnesses and injuries, this is one of those that we agree on the goal, but the process that we believe ought to be put into place is different. The Democrats believe that the government ought to dictate to insurance companies what they must do. We believe that you ought to provide for a powerful funding pooling mechanisms so that millions of Americans can pool together and get that purchasing power to be able to buy insurance even with a pre-existing illness or injury at a price that makes sense. That lawsuit abuse reform is another one. You can't be serious about this issue if you're not serious about lawsuit abuse reform.
And the wild card in the deck may be indeed tort reform, what you mentioned, Congressman. The president has said he is open to discussion on tort reform. Do you believe that? Can something get done about medical malpractice lawsuits?
Well, I sure hope so. As a former physician, I know that the practice of defensive medicine across this land adds hundreds of billions of dollars to the practice of medicine and the cost of health care in this nation. I can only take the president at his word, but I will tell you that we've been very disappointed in the past that in the fact that his word has not been kept. So we hope that his word will be kept on this and that he's willing to start over.
Do you believe the meeting will happen?
I suspect a meeting will happen. I'm not sure how productive it will be because you've got the Chief of Staff in the White House saying the Senate bill is where we start. You've got the Secretary of Health and Human Services, Catherine Sebelius, saying we're not interested in giving up where we've been so far. If that's the posture that they take, then they're not only not interested in talking with Republicans, they're not interested in talking with the American people. Because, again, the American people have said repeatedly, this is not the bill that they want for their health care.
Congressman Price, thank you very much.
Thanks, Brian.